Hi, I'm Stephen Hann. I'm running for Mayor of Onkaparinga. Today I want to talk about working in the Department of Health in the hospital area where I was a director for over 10 years. I want to talk about my work there, how I got the job and all that sort of stuff, and tell you what I did there, because this is kind of important for the council, for the line I want to go down with the council. Okay, with Onkaparinga. So I was fairly young. I was a assistant director in National Disability, so the National Disability Scheme. I was there and I was doing costings and stuff. And anyway, I was working on costs and all that sort of stuff for the National Disability Scheme. Anyway, a job came up in health. So I'm working in the Department of Social Security, and one of the ladies in my team, I say in my team, in the row next to us, her husband works in the Department of Health. And they're looking for an IT person who's really good at doing statistics and stuff. I can do that. I'm really good at statistics. I'm really good at IT stuff, right? Like, really good. No tag. Probably not good at writing, but this is what I'm good at. And so she said you should apply. I was like, kind of things are feeling good. I'll apply. So I applied. So I put my hand up. Hey, I like that job over there doing that stuff. So I go and meet with the guy. His name's Pete. Pete's pretty clever. He's a doctor of chemistry. He's kind of landed there. He's about to retire, right? So he's landed in this hospital area from TGA, the Therapeutic Goods Administration, and he's ready to retire. But anyway, the role is to do a report, an annual report on one of our data collections called the HCP, the Hospital Case Mix Protocol. And what that is, it's a data collection on costs of treating people in public and private hospitals, the costs of all the individual components, and how much the health funds pay you. Okay? It was funded for about 3 or 4 staff, and that I was going to go in and be the head of producing the annual report for that. So anyway, I won the job. So I go into thing not knowing anyone, not knowing anything about hospitals. I didn't know anything, right? Completely clueless. So I go in there, I'm like, okay, what do you want done? So I didn't know anything. I didn't know about anything about hospitals. Let's say that again. So they show me the annual report. I'm like, okay, so show me where stuff is. I'm like, okay, I can do this. So it used to take a year to do this, a group of people, and I was like, thought about it, and I did it in a week. So I'm like, there you are, there's your annual report, it's done. What now? And they're like, no, that's a year's work for the whole team. And I was like, oh, okay, what do we do now? And they're like, nothing, that's it. I was like, oh, okay. What can I do now? And they're like, nothing, that's it. I was like, okay, so what do we do with this data? What can I do? Where are my customers? And they're like, we don't really have any customers. Well, what do we do with this? And they're like, we don't really know. I was like, okay, let's go and find some customers. So we're in the Department of Health, 5,000 people. Who are the potential customers for our data? So I go and meet with the private health insurer group in the department. I'm like, I've got all this data. How can I be useful to you, and what can I do for you to help you out? So I go around and start to the department with this data. I'm like, could you use this? So I go and arrange meetings with all parts of the department. Hi, I've got this data. What can you do? What can I do for you? And I basically suggested stuff to them. Look, this is what I can do for you, blah, blah, blah. Okay, so this is what I'm doing. I'm trying to create a use for this data, hospitals data, because no one's using it. Probably relevant with COVID and what's happened over the past 2 years, but no one was using it. So I was like, okay, where else can I use this? Do you know who else would probably be interested in this? Private hospitals. They'd probably be interested in getting stuff back. And I thought, if I was a private hospital, what would I be interested in? I'd be interested in what other hospitals are charging for the same services. That's what I'd be interested in. I'd be interested in, like severity. So if I'm an old person getting treated versus a young person, is there a difference in costs? If I'm got more severe versus less severe, is there a difference in costs? And what's driving costs? So I was like, this would be interesting to me. So then I set up meetings with the Catholic Health Association, the Private Hospital Association, the Day Surgery Association, and I'm like, here's all concepts of stuff I can do for you. Then I met up with people in the Health Fund Association. I'm like, here's all this stuff I can do for you. Benchmarking, doing graphs and showing the difference between one hospital and another, different health funds, what different health funds are paying. So because it's all different. Even if you take something simple like renal dialysis is where they filter your blood, it's different. So one hospital might be $600, another hospital will be $200. So it's like, why is there a difference, Stephen? Exactly! This is the whole thing. Prosthetic devices that go in your body. One hospital might be $10,000 and one may be $15,000 for an identical device. Right? So then that starts the prosthetic data collection. So we start collecting data on prosthetics. What do they cost? Because it's different for each individual hospital. Public hospitals, private hospitals, different for the same device. Right, so we start reporting on all this stuff. Right, so I'm like, okay, this is what I'm doing. So and I'm like, well, how much could you save how much could you save if you paid the average price? And where's their savings and where are you making profits? So I started doing all these reports for hospitals around Australia, showing where they charge more, where they charge less than state averages. Because when the hospital contracts with a health fund, this is the stuff they negotiate. So I was empowering them with data. Okay, so this is where I'm starting. So I'm probably about 2 years in now, right? My boss retires. So Pete, really good guy, and I'm going to say he had really smart kids, and this is part of the thing of working with people. Really smart guy. His kids got straight A's, and he's like, get your kids into sport, they study and they do sport, and that's it. And I was like, well, your kids all got A's, maybe I'll do that with my kid. So my son, I get him studying and doing things, and he got 99.8, tertiary score. So okay, so that's part of the thing. So part of working with people and all that is networking and consulting. Right, so I'm doing hospitals. Now we outsourced a thing called the private hospitals data collection. It's outsourced because everyone likes to outsource information because we don't want to take responsibility for it ourselves. We'll outsource that. I was like, well, I said to my boss, maybe we can just do that inside and save $1 million. I said, give me one staff, $50,000. And I'll do it. He's like, no, that's too big a risk. Anyway, I have one boss, because bosses change in the public service. So I have one boss, and I'm like, give it back to me, and I'll be responsible for it. Anyway, by this stage, I've built up a big network of supporters as far as health funds, private hospitals, day surgeries, Catholic Health. And within the department, I built up a big network, a big umbrella of people who are basically supporting me, or I'm giving them information and working with them. So people trusted me. I'd built up my support base basically. Anyway, the boss said, yes, you can have it. So that was $1 million saving basically, straight there, bang, comes back in, and we start producing information for private hospitals. Now, we had to liaise with them, the private hospitals, have meetings and benchmarking groups. Anyway, there's another area which is cost in hospitals. That's a separate section. So I get a new boss in, and he's like, do you want to look after that section too, cost in hospitals? I'm like, sure. Sure. Give me everything. Bring it all in. So anyway, so I start costing hospitals. Public hospitals, private hospitals. We write software to cost hospitals. So previously we were paying for software to cost hospitals, and we were getting back pretty average results. In my view, you could probably tell I'm a little bit controversial, because the people who were happy with the results, they probably went, But I had some software, and I was like, well, here's my software, and which I wrote, or my team wrote, and it produces exactly the same results as yours if you put the same parameters in, but you can change it, and it's really easy to use, and bang, it spits out a result. Anyway, but that year, before we did that, we were getting 70% of private hospitals in the private hospital cost data collection. So 70% of private hospitals in Australia were involved. So I was like, well, I want to do better, because I always want to do better. I want to, shine. So I was like, well, I want to cost all the day surgeries. All of the day surgeries, I want all of them. So I get and meet with the day surgeries, and I go and meet with the CEO of the day surgeries, and she's lovely. And I meet with the heads of day surgeries, and they're all good, and they were like, this is what I can do for you. I can make your life better and easier. So suddenly I literally get all the day surgeries in Australia giving me data. They give me all their data, right? So anyway, so I want the private hospitals to be involved with the cost collection. We had 70% before, and our aim was 100%. So I'm like, look, I'd like you to be involved. Now, private hospitals were not keen to give this data to the Department of Health because they were like, we don't want you to know what our cost structure is. Right, they could never break it. Anyway, so I go to meet with them, and this was Main Nicholas, big hospital provider. I go there and meet with him. He's like, I know who you are. He goes, you can have all of them. I was like, what? No, he goes, no, he said, you did good work. He goes, you can have all my hospitals. Every hospital in Australia you can have. It was like a 2-second meeting. He goes, whatever you need, you can have. So literally, I go from having 70% of hospitals to every single hospital in Australia in the data collection. Overnight. Bang, just like that. And they were like, because they build up trust, and they're like, you're going to do something, you're there to do good things, and you're there to help us, so you can have it all. You can have whatever you want. And it was literally like that. Anyway, so my next boss comes in, and they're like, do you want the public hospitals? Now, the state health and the Commonwealth health departments don't like each other because the Commonwealth gives the health funds money and the Commonwealth Department of Health gives the states money. And there's friction between both. We want more money, the states say, and the Commonwealth goes, no, you've got enough money. And there's fighting, right? So there's these, it's like bang, bang, bang. And it's like, so this is what I'm going to be put in charge of. Great, thank you very much. I'm going to say the states didn't like us very much. That's the Commonwealth. It was like pretty hard work. At the time, the health minister is Tony Abbott. Now, what you ever think of Tony Abbott is your choice. I really like Tony. Tony rides a push bike to work, he's all in public transport, and he wants very simple stuff. He wants simple, easy to read stuff given to him. So it's got to be so a 7-year-old could read it. And I can do that. I can write stuff for a 7-year-old so that a 7-year-old can understand. Some of my staff weren't that happy because they were really good at English. But I keep stuff simple. So anyway, so when my stuff goes up to Tony, I get A's and they got C's. Which annoyed them because I'm not a writer, I'm more of a whatever I am. Anyway, so I get the public hospital data collection. I get the public hospital stuff, right? But the biggest problem is the friction between us and the states. And I'm like, so I meet with the states. I'm like, I'm not here to give you guys a hard time. I'm not interested. Like, this is not what we're here for. I'm here to make your life easy. I'm here to make your life easy. And I'd really appreciate it if you made my life easy. So let's talk about how we make each other's life easy. That's what I want. So previously, the states give the Commonwealth their data 6 months after the end of the financial year. And then we process it, the Commonwealth process it for about 6 months, and it goes backwards and forwards. So the data, by the time we produce anything, is about a year old. And I was like, that's crap. We can do better than that. So I get my team together, and I'm going to say one of the things, get people around you who are really smart, enthusiastic, and driven. And these are the people you want to build. Enthusiastic, driven people. That's what you want to build. And I have different people, really enthusiastic, bright people. The brightest people is what I try to recruit. People who are driven and people who want to succeed. That's what I had, bright people. And I had some people to fill my holes as far as my shortcomings. I had some people who are really good at writing, so that really helped me out too. Anyway, so I meet with their health departments. I'm like, look, this is what I want. So anyway, we write some software for them, which processes all their data, and when they submit it to us, it's done. So come the 1st of January, when they submit all their data to us, it just is finished. And in 2 days, we'd process the whole of Australia's health data. Never been done before. It used to take 6 months. It used to be a team of people. We did it in 2 days. So that's me processing the public health data. So I'm like, well, what can we do with all this? So I get a new boss. Went through lots of bosses, probably 16 bosses, right? So bosses are churning through. Some really, really bright bosses, I'm going to say, too. Some less impressive bosses, but there's some really impressive ones. There's lots of really, really smart people in the public service. 70% of people who work in the public service have degrees, and a lot of them are really, really smart. Okay, so new boss comes in and says, look, what can you do? Whatever you want, I say. Whatever you want, I can do. He goes, well, you tell me what we can do. He goes, we want to do some stuff to really impress people. Oh, okay. So we start doing things on like electorates and how many people are seen and how far people are traveling from A to B, and where we can save money and where we need services. And you click on an area, you can see how far people are traveling for services. You can see how many people need services in that area. Now, why this is important is because if you live in Onkaparinga, our hospitals, McLaren Vale and Nalunga, don't do a lot of services, so you're having to travel. You're having to travel for ED. You've got wait times. Now, this is all stuff I've done, right? So it's like, well, now we can have conversations about how long you're taking to be seen in ED, how far you're traveling for services, and further down south, how far you're traveling for services. And this has a big impact for the state, because if they're traveling, if people are having to travel for services, it's costing a lot of money. It's taking a lot of time for you. So hence the case for a hospital down south, to save time and money. Now, and there's a huge difference in costs between different hospitals. So it's a potential cost saving for the state government of millions and millions of dollars. It's not like, I'm not talking small amounts of savings here. It'll be millions of dollars saving. So this is the conversations I want to get into. Anyway, so we produce all this software and costs hospitals, and it does stuff and shows people. And when a minister goes to visit a hospital, it produces an instantaneous report on that hospital, how many people are seen there, where they come from, profiles on everything. That's what we did. Anyway, I had 4 teams of people working for me. They were really bright, all headed up by really bright people. So I was like, oh, I can retire now. I can retire. I'll leave you guys in charge and I'll leave. Which is okay, because they're really bright. Now I'm going to say, when I went to retire, I thought, well, that'd be fine. One of those will step up, because I had some people who were kind of, who were very bright people, who have gone on to have amazing careers. Okay. But they replaced me with someone who was ready for retirement, who wasn't as driven. That was sad, because I worked my ass off for years to do this and to build networks, and this is what I had built, and you replaced me with... Anyway, that was really disappointing, but that was really disappointing. It crushed me. I was like, I worked so hard for this, but bosses had changed, and then you replace it with this. No disrespect to him, and it probably is, but I was like, I want people driven. I want people who want to do stuff. I want people who want to see improvement and change and make things better. That's why I'm running for mayor. I want to see things better in hospitals down south, 170,000. If you need a baby, like, I'm keeping life simple here. If you need a baby, you've got to go to Flinders. I don't think that's acceptable. If you need emergency services, there's like Flinders is full, Nalunga's full. We didn't get any funding for our hospitals down south. Zero. Didn't get anything. And Flinders got 400 million. They built a new Royal Adelaide hospital, and they go, right next to it, we're going to build another big hospital. I'm like, what? You're going to build 2 hospitals alongside of one another? Oh. And nothing down south. Nothing. How about you build the Women's and Children's Hospital down south? We've got great roads, we've got great infrastructure. Anyway, I understand there's political decisions made. I understand that. I just want people driven. That's all. That's my Department of Health. So I finished with 2 departmental awards for my work in the department. So each year they give out 1 award. I got 2. I think we should have got more. I think our team should have got more. I'm going to say that because I think we worked harder than anyone else, and that's not me having tags on myself. We worked really, really hard, and I had really bright people. Like, really, like, I cannot stress how bright my staff were. Amazing, committed people. And I had to get rid of some, right? So I'm going to say that too. I got rid of some because they weren't... Anyway, I'm not going to talk about that. But the people I had there, it was a very tight-knit group who worked... They did amazing stuff. Saved millions and millions of dollars. Kept health fund costs down. And you're going to say, well, health funds costs have gone up. Yeah, because we don't do this stuff anymore. Why don't they do it anymore? Because people moved. Because they didn't feel valued. They didn't feel valued. They didn't feel... I had a person who come in and was like, oh, I want to retire. I got no interest in all this stuff. I don't know about data. I don't know about information. I don't know about hospitals. I'm just ready to retire next year. I'm waiting for her to turn whatever age he was turning. And anyway, people moved on. They were like, well, I don't want to work for that person. So all these bright people left. One's an international banker now. But anyway, these people left because they were bright and they want to work for energetic people who want to do things. And they all left. It's very sad. And I think you need people with drive and commitment at the top. And you need them at the bottom, and you need energy. Anyway. That's my Department of Health. So I had two awards. I met amazing people, bright people, people who touch you forever. I met nasty people, bullies. I met all sorts of people, public, private, differing views. It's all good because people want the same outcome. People want to make things better. Some people just want to be there because they want to get their check. Okay. You want to get your check and go home. You don't want to do any extra work. That's okay. You sit in the corner and play in your computer game, right? I didn't have that in my team. I got rid of those people. They went elsewhere in the department. So I got rid of them and got people in. I got young people, trained them up. Lots of energy. Lots of can-do attitude. So that's my experience working in the Department of Health, trying to improve things and make things better, and I think we did. I think we had an amazing team, and we were acknowledged for that by the department and by the private hospitals and the public hospitals, with day surgeries. So my drive for the Onkaparinga region, 170,000 people live south, half the size of Canberra. There's 3 private hospitals in Canberra. There's effectively none down south. 2 public hospitals in Canberra, effectively none down south, and I'm sorry, Noongar, you're pretty much a day surgery now. They've made you a day surgery, and we'd like to see more services. I would like to see more services at Noongar. I think for people having to travel for services, it's a problem. But I'm going to do a whole nother video on how I intend to get this stuff through. So if I don't get voted in, I probably won't get voted in. That's okay. Democratic process, that hopefully some people will take it up, and some of the candidates have said, look, we really like this idea, so we'd like to talk to you. If we get in, you don't, to make this stuff happen. I'm like, I'll just do a video and tell you how to do it. Anyway, I'm Stephen Hann. Thanks for your time. Bye.